Nagkamali-mali ako ng grammar, kaya nang bahalang umintindi, ha? My family. Oh my gosh. Being Suzette, hi! Watching, thank you then. Pardon me kung, ay, English pala siya. Sorry po. Pardon me if I will have a few words in Tagalog, if you don't mind, but I will try my best to carry out the lecture in English, okay? Hirap. Dumi ilong ko. So hard. Watching from UAE, Aprilyn Berloria. Hello, kamusta naman? Gandang umaga. Pwede nang gumala hanggang alas 8. Okay na? Pwede na yan. Sige, bahala na kayo kung game ka. Maka-join. All right. So, like what I said a while ago, when we talk about health promotion and maintenance, it actually involves helping your clients achieve and continue to enjoy optimal health. It's your responsibility as a nurse to help identify what are their target state when it comes to health and wellness. You also help them discover their strengths and their needs, and it's your responsibility to support them in their path in achieving full health and wellness potential. If you put enthusiasm into screening, education, and treatment, this can actually make a significant difference and can contribute to your patients achieving successful outcomes. In any type of international examination, most particularly the NCLEX RN examination, you can expect health promotion and maintenance questions about 6 to 12% or 9 to 12%. And then this category focuses on your knowledge about growth and developmental principles, different ways to prevent diseases, or even early detection of health problems. And it also includes different strategies in achieving optimal health. The exam content related to health promotion and maintenance in any type of international examination would include not only obstetric nursing, pediatric nursing. It would also involve your aging process, different developmental stages and transition, health promotion, disease prevention, health screening. This is also covering high-risk behavior, lifestyle choices, even self-care and techniques of physical assessment. Okay, you guys ready? Let's take a look at our first question. Let's take a look at our first question. And this is related to what we call the aging process. Okay, let us read the question. Nurse Andrew is performing an assessment on an elderly patient. Which are the normal age-related physiologic changes should he expect? Select all that apply. Normina Tahalang, how to be you po? Aw, thank you. I wish. Way Kines, watching here from Baguio. Hello, hi Baguio. Namiss ko na ang Baguio. Ang tagal ko nang hindi nakakapunta ng Baguio. Diyos ko Lord, sana po matapos na ito lintik na corona na ito para balik na sa ating bayang Pilipinas. Okay, we have 6 choices. You have increased heart rate, decline in visual acuity, decreased respiratory rate, decline in long-term memory, increased susceptibility to urinary tract infections, and increased incidence of awakening after sleep onset. Now, if you are going to answer this question, you have to focus on the subject, and that is what we call the normal age-related physiologic changes. All you need to do is to read each characteristic and think about the changes that happens through, or that occurs rather, with aging for you to be able to select the correct item. Teka lang, nagkakaroon daw po ng delay sa pag-transition. Okay. Ma'am, hindi po nag-change yung slide. Ay, wait na, I'm so sorry, Jen. Yun na nga ba sinasabi ko, hindi siya nag-change. Wait lang. Hindi nyo pa rin nakikita yung slide? Ako lang po ba yung di nakakakita ng question? Queenie, I think it's a lot of you guys. Ma'am, walang slide. Okay. Wait lang po natin. Hindi ko alam kung anong problema dito ay kahit hindi makita ang tinatawag na slide. Okay, doke. Okay, doke. Wait. Ayan, nakikita nyo na po ba? Alright. Aging process. Nakikita na po ba natin, mga kabayan? New comment. Slideshow po, ma'am. Opo, wala pong slide. Ayan, okay na? Okay. Kaya ba kayo sad? Ayan na siya. Alright. Ulitin natin ha. So, Nurse Andrew is performing assessment on an elderly patient. Which of the following normal age-related physiologic change should he expect? Select all that apply. Like what I said a while ago, when you are going to answer this type of question, you also have to focus on the subject, which is age-related physiological change, and then read through each item and identify ano ba yung mga normal na nangyayari as a person age. Isa-isahin natin siya. Let's look at the first item, which is increase in the heart rate. Will there be increase in the heart rate as you age? Okay na po. Ma'am, wa ko'y makita na slide. Day, andyan na siya, Day. Yes po, ma'am. Opo, ma'am. It's good, ma'am. Okay. All right. So, balik tayo sa tanong ko. Increase in the heart rate. Will there be increase in the heart rate with aging? Actually, as a person age, heart rate actually decreases. And kahit yung heart valves niya, has a tendency to thicken. So, let's look into our first item at i-cross out po natin siya because hindi po siya kasama sa tamang sagot. So, increase in heart rate, mali daw po because as you age, sabi natin, there would be decrease in the heart rate. Even thickening of heart valves is also expected as we age. Heart valve thickening. Okay. Sensya na po sa pagkapangit-pangit kong sulat. Okay. Let's look into the second choice, which is decline in the visual acuity. Decline in the visual acuity. Now, this is actually a correct choice or a correct item because anatomical changes in the eye affects a person's visual ability that can actually lead to a potential problem with ADLs or the activities of daily living. There will be reduction in light adaptation, visual fields, even decline in the visual acuity. So I'd say number 2 is actually a correct answer. So select all that apply. We have multiple choices here. Let's look into the third choice, decrease in the respiratory rate. Will there be a decrease in the respiratory rate as we age? Actually, it's the lung function that decreases, but the respiratory rate remains unchanged. Ulitin ko ha. Ito po ay tinatawag na mali. Like what I said, there would be decrease in the lung function, but our respiratory rate will remain unchanged. Okay? So maling sagot din po ang number 3. Alright. So okay na ba tayo? Mabilis ba guys? Or sakto lang po ang ating pace? 2, 3, 4, 6 ang hula ko. Ayun laang. Alright. Next item. Decline in long-term memory. Meron ba silang decline sa long-term memory or short-term memory? Tandaan niyo, when you're talking to older people, particularly yung mga lolo't lola natin, ang mga naaalala nila yung nangyari nung panahon ng Hapon. right? Pero hindi nila maalala kung uminom sila ng gamot kaninang umaga. So there isn't a decline in a long-term memory. Actually, short-term memory po ang nag-decline. Pero ang kanilang long-term memory is usually well-maintained. Kaya ang ating mga elderly people, they love telling you story about what happened 1940s, 1950s, ganun kahaba ang kanilang, or ganoon kalayo ang kanilang backstory. So number 4 is actually a wrong choice. Next, increased susceptibility to urinary tract infection. This is actually a correct choice. It is actually noted that age-related changes that affects rather the urinary tract increases an older client's susceptibility to urinary tract infection. So this is a correct answer right here. Next is increased incidence of awakening after sleep onset. Ito po ay tamang sagot din. Ang ating pong mga elderly patient, there is a consistent change in the sleeping pattern as you grow older. They experience increased incidence of awakening after sleep onset. Sila po yung parang mga manok kung matulog. Very short, madali pong magising. Minsan maaga silang matulog, maaga din silang magising. So for our first question, our correct answer is 2, 5, and 6. Pamain na lang po sa mga tamang sagot. 2, 5, 6, tulog man. Sabi ko na mali hula ko. Okay lang yan. Alright. Miss Yudra, how are you po? Hindi pala kasama yung 4. Yes. Kasi long-term memory, hindi siya nagde-decline. Short-term memory ang nagde-decline po sa kanila. Okay. So, katulad ng sabi ko kanina, ating health promotion and maintenance includes yung tinatawag nating aging process. And aging process, you have to remember, guys, unfolds gradually, and it usually starts during the infancy stage or the first year of life. After that, the school will become the dividing marker ng different stages, which therefore, ang ating pre-adolescent stage is actually divided into 2 parts or 2 stages. You have the preschool, which is usually 1 to 4 years old, and then you have the school age, which is about 5 to 12 years old. Now, puberty marks the onset of the adolescent stage, and that is within 13 to 18 years of age. Adulthood, on the other hand, is divided into 3 parts. You have the working years, the retirement years, and the elderly years. Working years is about 19 to 64 years of age. Retirement is about 65 to 85, and elderly is about over 85. As you review for your international examination, make sure that you understand kung ano yung mga needs ng ating mga pasyente for each of this age group so that you can provide the necessary care, the necessary education that is required or that is needed. Whichever stage ang pasyente mo, whichever stage the client you are in, you need to be able to assess their reaction that is considered expected sa kanilang particular age group. So, ang maibibigay kong example dito is, kung halimbawa, they're moving from another state or to another city, you have a teenager at home and you have an elderly person at home. Mas madaling makaka-adjust at madali ang transition sa mga teenagers compared sa ating mga elderly nakasama sa bahay because they're more of familiarity. They're more of inclined na magstay sa kung saan nandoon sila. Teenagers would probably throw a fit at the beginning, but once that they start to make friends, once that they settle in this sa school, it's going to be easy for them. Okay, so aging process is one of the things that we have for health promotion and maintenance. Health promotion and maintenance. Okay, let's proceed to the next question, which is about obstetric nursing and prenatal care. Nurse May is performing an assessment of a pregnant client who is at 28 weeks gestation. She measures and notes that the fundic height is at 28 centimeter. How should you interpret this finding. Okay. Ang pag-uusapan natin dito is concept of obstetric nursing. You have to focus on the subject, and that is the location of the fundic height. You have to remember to be able to answer this question during the second and the third trimester of pregnancy. The fundic height in centimeters is approximately equal to the fetus age in weeks. So kung siya ay nasa 28 weeks of gestation at ang fundic height niya is 28 centimeter, of course, our answer is that the patient is measuring normal for gestational, temprano gadoy despierta. Ano pong ibig sabihin po nun? Goya diskinsa anay kaa. Durmi anay yu tuele mi cabeza. Yay, tama wala. Okay, isa sa mga paboritong topic when it comes to international examination is different assessments, particularly during pregnancy, assessment of fetal growth, at mga computation na meron tayo. So let's look into our first assessment, which is the expected date of confinement or expected date of delivery sa ibang book, EDD or EDC yan. Sa ibang mga references. Nagel's rule. Ito po ay -3 plus 7 plus 1. -3 plus 7 plus 1. So for the patient's last menstrual period, para makuha mo yung kanilang expected date of confinement, particularly if they are their last menstrual period is about April to December, -3 plus 7 plus 1 lang po ang ating computation for the Nagel's rule. Kung sila naman po ay with LMP of January to March, instead of -3 plus 9 plus 7. Okay? Dali lang siya. Alright? Apart from the estimated date of delivery or confinement, a part of prenatal care is what we call ang tinatawag nating assessment of fetal growth. And with international examination, lagi niyong tatandaan that they're very acclimated with comparing things. So pag-usapan natin yung pagkakaiba ni McDonald's rule with the Bartholomew's rule. Si McDonald's rule, it actually estimates fetal growth in utero, same as the Bartholomew's rule. Kaya lang kasi si McDonald's rule, it actually has a computation. At anong sinasabi sa computation na ito? If you are to estimate the age of gestation, you have to take into their fundic height in centimeter, yeah, and then multiply it by 2 divided by 7, you are going to get the age of gestation in months. Okay? Kung gusto mo naman makita yung kanyang age of gestation in weeks, yung kanyang fundic height in centimeter, multiply lang po natin siya into 8 divided by 7, you are going to get the age of gestation in weeks. So Bartholomew's rule is just based on the premise that the mother's gravid uterus or yung kanyang abdomen has 3 specific locations or 3 specific markers. Yung kanyang symphysis pubis, umbilicus, and the xiphoid process. Okay, ulitin natin. Symphysis pubis, umbilicus, and the xiphoid process. It is said that if the fundic height is in the symphysis pubis, the patient is approximately 12 weeks pregnant. Halfway between umbilicus and the symphysis pubis, siya ay nasa 16 weeks. Kung siya ay nasa umbilicus, ito ay 20 weeks. Kung siya ay nasa xiphoid process, siya ay nasa 36 weeks. Kung ito naman po ay halfway between umbilicus and the xiphoid process, this is about 30 weeks in pregnancy. So McDonald's rule and Bartholomew's rule. Si McDonald's rule, may computation, may formula po tayo. Si Bartholomew's rule, it's just based on the premise that there are 3 specific locations when we are looking into the fundic height. That is the xiphoid process, the umbilicus, and the symphysis pubis. Okay po ba tayo? Nagpo-follow po ba? Tingnan natin ang kanilang mga comment. Okay. Alright. Kaya, tuloy tayo. Okay. All right. As part of assessment of fetal growth, apart from McDonald's rule and Bartholomew's rule, you have Johnson's rule and Hayes' rule. Pag sinabi po natin Johnson's rule, you are estimating the fetal weight. You are estimating the fetal weight in grams. You are estimating the fetal weight in grams. Ang ating pong formula dito is that the fundic height in centimeter, the fundic height in centimeter minus n times k. Okay? Ang ating k is always constant. This is always 155. Ang ating n po is either 11 or 12. You are going to use 11 if the patient is not yet engaged. Not yet engaged. 12 kung siya po is already engaged. Ulitin ko ha, sa ating Johnson's rule, you are estimating the fetal weight in grams by using the formula, fundic height in centimeter, subtracted by n times k. K is always constant, that is 155. N depends if it's 11, not engaged, 12 engaged. Our Hayes' rule, on the other hand, is estimating the fetal length. Okay, si Johnson's rule is weight, ito po ay length. Ano po ang sinasabi dito? In the first 5 months of pregnancy, you need to square the number of months. The first 5 months of pregnancy, you need to square the number of months. Ibig sabihin, 1 times 1, 2 times 2, 3 times 3, 4 times 4, 5 times 5. Alam ko po, mga nurses, medyo weakness po natin ang math at ang ating pong mga utak kapag ka computation na ng math is medyo mabagal. Parang 1 times 1, 2 times 2. Okay? Joke lang. Okay, let's continue. Yung atin naman pong Hayes' rule, pagdating ng 6 months onwards, instead of squaring it, you actually have to multiply the number of months by 5. So paano po ito? Number of months by 5. Number of months by 5. So 6 times 5, 7 times 5, 8 times 5, 9 times 5, so on and so forth. Bahala na po kayong mag-compute. Okay? So, recap. Johnson's rule and Hayes' rule. Johnson's rule is estimating the fetal weight in grams using a formula. Hayes' rule is estimating the fetal length by using a guideline that on the first 5 months, square natin siya. On the next 6 months onwards, i-multiply natin siya by 5. Okay? Okay po ba tayo? All right. Let us proceed to okay. Isa pa sa favorite when it comes to international examination is fetal heart rate monitoring. Let me just read the question right now. Nurse Annie reviews the result of a non-stress test performed on a pregnant client and interprets the finding as which of the following. So ito po yung ating strip. Ano po? Ano daw po ang ating findings dito? For us to be able to answer this, let us discuss the non-stress test and the contraction stress test. Like what I have mentioned a while ago, in international examination, favorite po nila yung comparison ng dalawa. So what is non-stress test? What is non-stress test? Non-stress test is a test that is performed to assess placental function and oxygenation. It actually determines fetal well-being. You are evaluating the fetal heart rate in response to the fetal movement. So paano po ito ginagawa? An external ultrasound transducer and tokodynamometer is applied to the client, and a tracing of at least about 20 minutes duration is obtained para makita po natin yung fetal heart rate and uterine activity at ma-observe natin siya during that duration. If you are a nurse caring for a patient that is to receive the non-stress test, you have to get a baseline blood pressure, and the mother's blood pressure needs to be monitored frequently. Okay. Positioning of our client should always be side-lying position para maiwasan po natin ang vena cava compression. And your patient may actually be asked to press a button every time that she would feel a fetal movement, so that ma-record po yon or ma-mark yung each point na yon with fetal movement. This will then be used as a reference point para ma-assess natin ano ba yung response ng kanyang fetal heart rate. So, pag-usapan natin ang result. Dalawa po ang result when it comes to the non-stress test. You have the reactive and you have the non-reactive. Reactive and non-reactive. Okay. Reactive and non-reactive. Ano pong sinasabi natin dito? When you have a reactive non-stress test, this means that your test is normal and is a negative finding. Normal and is a negative finding. A reactive non-stress test usually indicates a healthy fetus. You would see that a test result is reactive when you have 2 or more fetal heart rate acceleration. Ibig sabihin pagtaas ng fetal heart rate of at least around 15 to 20 beats per minute that lasts for about 15 seconds from the beginning of the acceleration to the end of the acceleration that is usually associated with fetal movements in the duration of that 20-minute period. Ulitin ko ha, the non-stress test is actually a normal result and a negative finding. Dapat daw po meron dalawang fetal heart rate acceleration or pag-increase, yeah, of about 15 to 20 beats per minute that actually last for 15 seconds in the duration, in the 20 minutes na ikaw ay nagkuha nito. Now, in the non-reactive side, ano naman ang ibig sabihin nito? This is a abnormal finding. This is a abnormal finding. Anong ibig sabihin nito? No acceleration is actually noted, or meron man pong acceleration pero less than 15 beats per minute, and it may also last less than 15 seconds in the duration. And sometimes, if this is done in the bedside, hindi lang nila ginagawang 20 minutes yung observation, in-extend nila yung observation into 40 minutes. Now, if the patient has an abnormal finding rather in the non-stress test, they would usually resort to doing the contraction stress test. Contraction stress test. Ano naman po ang pagkakaiba ni contraction stress test with the non-stress test? In the contraction stress test, you will still assess the patient's the baby's well-being, but you are determining the baby's ability to tolerate labor by inducing or by giving a small amount or small dose of oxytocin. In other situations, they would use nipple stimulation. So same setup. An external fetal monitor will actually be applied to the patient, and a baseline strip of about 20 to 30 minutes will be recorded. The uterus will be stimulated to contract, again, by administration of small dose of oxytocin or nipple stimulation. With this, you have to make sure that there is frequent maternal BP monitoring, and the mother is closely monitored as we increase the amount of oxytocin. Now, when we talk about contraction stress test, ang ating pong result is either negative or positive. Negative or positive. Anong ibig sabihin nito? If you have a negative contraction stress test, this means that as you do the procedure, there are no late decelerations that is noted. No late decelerations that is noted during the examination. Kapag ka naman siyang positive, of course, there is presence of tinatawag nating late deceleration. Bago natin pag-usapan yung iba't ibang klase ng fetal heart rate variability, balik muna tayo dito sa ating question. Ano ba ang tamang sagot dito? Our correct answer is none. Our correct answer is what? Hello? Hello? Opo ay, hello? Hello, guys, can you hear me? Hello? Ang ating correct answer here is tinatawag na reactive. Tinatawag po nating sagot ay reactive. Hello? Hello? Guys, naririnig niyo pa po ba ako? Hello? I feel so alone. Do you guys hear me? Yes, reactive is the correct answer. Okay na? Okay na po tayo? Alright. So, katulad ng sabi ko kanina, isa sa mga paboritong gawin ng international examination is to compare. Okay? In relation to the fetal heart rate monitoring, let's talk about the different fetal heart rate variability, starting with the early deceleration. Ano ba ang early deceleration? Sabi natin kanina, pag sinabi nating acceleration, this is increase in the fetal heart rate. Pag sinabi nating acceleration, this is increase in the fetal heart rate. Pag sinabi naman nating deceleration, this is decrease in the fetal heart rate. Early deceleration, although nagde-decrease ang kanyang ang fetal heart rate ng ating baby, this is not something that we need to be worried about because this is just related to what we call fetal head compression. If you are to assess the client, makikita ninyo na ang kanyang fetal heart rate actually decreases as the contraction goes on. Okay? So kahit na siya ay variability, this is something that we don't need to worry about because this only happens when the baby's head is being compressed at the duration of the uterine contraction. If you notice, bumabalik po sa normal ang kanilang fetal heart rate as the uterus stops to contract. Okay? If you are to look into the fetal heart rate variability, ang kailangan po nating monitoran is yung tinatawag nating late deceleration. If late deceleration happens to your patient, this is usually related to what we call supine hypotension. Meaning nagkakaroon ng compression ng vena cava dahil ang nanay po ay nakalay flat in bed. Okay? Although this is decrease in the fetal heart rate na makikita ninyo along with the contraction, ito po ay napakadaling i-manage, napakadaling i-treat. You just have to change the mother's position. If you note that the late deceleration has also something to do with oxytocin administration, it's your responsibility or our intervention is to stop oxytocin. Yung tinatawag nating late deceleration. Okay? Now, let's look into the last fetal heart rate variability or yung tinatawag po nating variable deceleration. What is variable deceleration? Regardless kung nagko-contract ang uterus or not, there is an erratic decrease in the fetal heart rate at unpredictable times. There is a decrease in the fetal heart rate that usually occurs at unpredictable time. This may be indicative of umbilical cord compression or yung tinatawag nating umbilical cord prolapse. Our management for this is to change the mother's position to knee-chest position. Now, as nurses, our responsibilities in terms of non-reassuring fetal heart rate, i-remember po natin si cup mode. Kapag po meron tayong pasyente na may non-reassuring fetal heart rate, Tandaan po natin si CAP mode para tayong magiging pulis dyan. Pupulisin natin ang assessment nating sa ating mga pasyente. Let's start with identifying the cause. Since we have multiple types of fetal heart rate variability, you have early, you have late, and you have variable deceleration. As a nurse, you have to identify ano ba yung nag-cause ng deceleration. Okay? After that, you also have to ensure oxygen is administered to our patient. Usually, oxygen is along with the transfusion of intravenous fluid. Ano pa? Letter P, position. Cup, position. So, kung siya ay may late deceleration, side-lying position siya. Kung siya ay variable deceleration, mean chest position. Cup mode. Ano naman yung letter M? Letter M is to include or to continue rather, continuous fetal heart rate monitoring. Continuous fetal heart rate monitoring. Ano pa? If this is caused by oxytocin, you have to remember to stop the administration of oxytocin. If the patient's condition actually gets worsened, kailangan po natin i-prepare ang ating nanay for a cesarean delivery. And lastly, letter E is for event documentation. Part of our regular or routine responsibility as nurses is to document yung nangyayari sa pasyente. So for non-reassuring fetal heart rate, tandaan, COP mode. COP mode, C-O-P-M-O-D-E. Identify the cause, administer oxygen, change the mother's position, continue fetal heart rate monitoring, stop oxytocin, prepare for delivery, and document event or document the findings. Okay, pa po ba tayo? Hello, telephone. Yes, ma'am. Narinig po. Di lang namin alam ang sagot. Sino to? Irene. Oh, malalaman nyo rin yan. Sige, basa-basa lang. May sound ba? Yes po, ma'am. Naririnig po, ma'am. Di lang ako nang hula uli. Baka mali uli. Early deceleration. Charming. Hi, Ma'am Charm. How are you today? Okay. Teka. Wala ko ng tissue, guys. Kanina pa ako. Wala po akong coronavirus. Ano po? Disclaimer po ito. Okay. Alright. Okay na ba tayo? Pwede na tayong magpatuloy sa ating mga pakikibaka sa buhay. Okay. So when we talk about prenatal care, sabi natin, our responsibility is not only to assess fetal growth, tulad ng mga formulas na pinagsasabi natin kanina, isa pa sa pinaka-famous or pinaka-lagi, paboritong tinatanong sa examination is fetal heart rate monitoring. Okay na tayo? Okay na po ba tayo? Tayo ay mag-proceed na. Kung may prenatal care, of course, let's look into the intrapartum care. Intrapartum care. Okay, the nurse is reviewing the record of a client in the labor room and notes that the healthcare provider documented the fetal presenting part is at -1 station. This documented finding indicates that the fetal presenting part is located at which area. Paboritong-paborito po ito sa mga international examination, particularly NCLEX examination. May mga figure. Kailangan nyo i-identify, kailangan nyo pong i-identify kung ano ang tamang sagot. Ano ba ang tamang sagot natin dito sa number? Sa ating station question. Ano ba ang station? Station is actually the measurement of the progress of the baby's descent in centimeters, either above or below the midplane from the presenting part of the ischial spine. Okay, usually measured in centimeter and noted as a negative number kapag above ka sa ischial spine, positive kapag below ka sa ischial spine. Isa-isahin natin. Si option number 1, si option number 1, na andito siya. Kung ito po ang level natin ng 0, or ito yung level ng ating ischial spine, bilangin natin 1, 2, 3, 4, 5. Ang ating number 1 is nasa -5 station. So, hindi po yan ang tamang sagot. Hindi po yan ang tamang sagot. Ang ating number 1 is nasa -5 station. Puntahan naman natin si number 2. Si number 2 ay, ito yung 0, 1, 2. Nasa -2 station siya. Nasa -2 station siya. So, meron na lang tayong number 3 at meron na lang tayong number 4. Ano pong tamang sagot natin dito? Ito si number 3, minus 1 station eh. Ayan siya, oh. 0, minus 1. Okay? Ano yung number 4? Si number 4 naman, nasa positive 3 siya. Positive 3. So, ito yung 0, plus 1, plus 2, plus 3. Plus 3 station. So, ang tamang sagot natin dito ay number 3. Okay. Isa pa sa pinaka-paboritong tinatanong when it comes to the international examination is the different principles or the different piece of labor and delivery. Different piece of labor and delivery. Okay. Ano po yung mga 4 P's na yon? You have the power, the passageway, the passenger, and sight. Power, passageway, passenger, and sight. Unahin natin si power. When we talk about power, hindi po ito yung tinatawag na marketing strategy power. Hindi po yan, ha? Hindi rin po ito kili-kili power. Yeah? Bango pa naman siya. Bango-ligo pa naman siya. Okay. When we talk about power, this talks about uterine contraction. You have cervical effacement and dilation. Let's look into uterine contraction. Okay? So, uterine contraction. Pangit naman ang sulat. Sorry, guys. Wait lang. Erase natin siya. Shift wangit. Okay. Okay. Aha. Okay. Ang uterine contraction is actually has 3 parts. Yung tinatawag nating pag-increase. This is what we call the increment. Okay? Yung peak ng uterine contraction, yun tinatawag nating acne. Yung pagbaba niya, or pag-decline niya, is what we call the decrement. Okay. To ensure successful labor and delivery, uterus should actually contract. And you know that the mother is ready for labor and delivery is that if the uterus contracts so powerfully, or forcefully that it facilitates cervical effacement and dilation. Pag sinabi nating effacement, this pertains to the shortening and the gradual thinning of the cervix that is usually measured in percentage. So kapag siya ay 0% efface, ganito ang kanyang itsura. Kung siya ay 50% efface, makikita nyo medyo shorten na siya. 100% efface looks like this. Sinabi naman natin cervical dilatation or cervical dilation, this is the gradual opening of the cervix that is measured in centimeters. Effacement, percentage. Dilation, centimeters. Ito po siya. From 1 to 10 centimeter. From 1 to 10 centimeter. Ito natawag nating power. Okay? Let's look into the next one, o yung tinatawag nating passenger. Sinabi nating passenger, ito po yung tinatawag nating fetus. Ang pinag-uusapan natin dito is fetus. It is said that to ensure successful labor and delivery, hindi lang daw po nagkakaroon ng forceful, intense uterine contraction that leads to cervical effacement and dilatation, dapat yung components ng dadaan is favorable then for labor and delivery. Pag sinabi nating attitude, hindi po ito attitude problem. This pertains to the relationship of the fetal body parts into one another. The relationship of the fetal body parts into one another. Anong ibig sabihin nito? Pag sinabi nating attitude, relationship of fetal body parts into one another. Fetal body parts into one another. Ano ibig sabihin nito? The baby or the fetus that is inside should assume a complete flexion or complete flex position, wherein the head is drawn towards the chest. The baby has a rounded back. Yeah, the extremities, upper and lower extremities are also inside or in the middle of the body. Kapag ang baby daw po is naka-flex position, it gives you the smallest diameter possible or smallest diameter possible that is favorable for labor and delivery. Tandaan ninyo, meron pong batang lalabas of about 10 pounds na lalabas sa ganito kaliit na butas. Siguro naman po, hindi na po nakakahiya sa fetus na siya ay mag-flex position. Ano? Tama? So pag attitude, hindi to attitude, problem. Tama? Attitude is the relationship of the fetal body parts into one another. Attitude, relationship of fetal body parts into one another. Okay, let's look at the next component when we talk about the passenger. Yung tinatawag nating fetal lie. Fetal lie. Pag sinabi naman natin fetal lie, this is the relationship of the mother's spine to the baby's spine. Kung ito po ang ating pregnant na nanay, okay, ang kanyang spine is towards this way, okay? Ang baby na nasa loob, ang kanyang spine is towards this way. Ano ibig sabihin nito? In order to have a favorable labor and delivery, the mother and the fetal spine needs to be parallel to each other. Needs to be parallel to each other. Meaning, kahit cephalic or breech presentation, posible ang normal, spontaneous labor and delivery. Okay? That is what we call the fetal lie. Now, what if the mother's spine and the baby's spine, instead of being parallel to each other, sila daw po ay perpendicular to each other. Sila daw po ay perpendicular to each other. Ito magkakaroon ng tinatawag nating shoulder dystocia. Dito po magkakaroon ng tinatawag nating shoulder presentation that can lead to difficult labor. Tinatawag nating shoulder dystocia. Okay po ba tayo? Nakakasunod pa rin po ba? Nakakasunod pa rin po ba? Okay tayo? So fetal lie, relationship of the mother's spine to the baby's spine. In order to ensure successful labor and delivery, the mom and the baby's spine needs to be parallel to each other. If in case nagkaroon ng perpendicular relationship ng mother's spine and then the fetal spine, this can actually lead to difficult labor later on. Okay? All right. After that, let's talk about the presentation. Tulad ng sabi ko kanina, cephalic or breech presentation, possible ang normal, spontaneous vaginal delivery. Pag pinagsama natin si presentation at saka si attitude, ang presentation daw po na vertex, ganito ang kanyang itsura. It gives you the smallest size possible para magkaroon ng favorable labor and delivery. Now, paano po yung military presentation? Si vertex presentation, head is towards the chest, yeah? So, ang presenting part, ito, maliit siya. Okay, now, kapag ka military presentation, the extremities may actually be inside the body, the back is still rounded, but the head is slightly extended. Tinatawag nating moderate flexion. So, ibig sabihin ganito siya, ganito ang kanyang, ganito ang kanyang position. Wala parang military position. Ano siya sa iyo. Morning, sir. Okay? Kapag brow presentation naman, nakaganito pa rin, but yung kanilang head is slightly extended. Yung kanilang head is slightly extended. Ito po, kilay is like ang presentation. Kilay is like ang presentation. Okay? Kapag face presentation naman, the baby is in full extension. Ito po. Ito po ang presenting part, ito or ito. Okay? Okay po ba tayo? Sabahan niyo, tinatawanan niyo ako. Okay. Alright. Okay lang yan. Pause lang. Okay na tayo ha sa presentation. Okay. Let's move on to the breech presentation. So this time, ang presenting part, hindi po ang head. Ang presenting part is the baby's buttocks. And there are different variations when it comes to breech presentation. You have the complete breech, meaning kahit po na ang presenting part is the buttocks, the baby still assumes a flexed position. The baby still assumes a flexed position. Kapag incomplete breech, one of the baby's extremities is actually extended. Kapag frank breech naman, both lower extremities is actually extended kahit daw po na naka-flex yung kanyang upper extremities. You still have yung tinatawag nating footing bridge wherein ang presenting part hindi po puwet, ang presenting part po ay paa. All right. ito na yung pinag-usapan natin kanina, si pelvic station. Sabi natin kapag nasa level 0, it's the level of the ischial spine. Yeah? Pag sinabi naman po nating station, ito yung measurement ng progress ng descent ng baby in centimeters, wherein kapag ang pasyente or kapag ang baby is already engaged, the widest diameter of the presenting part has already passed the pelvic inlet, which actually corresponds to a 0 or a 0 station. Okay. All right. Any question when it comes to labor and delivery? Labor and delivery. Okay. Tulad ng sabi ko kanina, hindi lang po OB ang famous na question when it comes to health promotion and maintenance. Kasama din po dito yung pediatric nursing concept, particularly different principles of development along with transitions. Okay. Tignan natin ang sample question at ang paboritong question na tanongin sa atin with an alternative test format. Okay? Number in order of progression, the gross motor development of an infant from age 2 weeks to 15 months. Noting that number 1 is the first motor skill that actually develops at 2nd week, and number 6 is the motor skill that develops at 15 months. Okay? So number in order of progression. Sige. Hayaan ko kayong hula. Ano sa tingin ninyo ang number 1 dito? Kamay na lang po kung ano po yung number 1. Pa-comment down below. Sirit na? Sama ba yung tinanong ko? Okay. So, tignan natin. Ano ang number 1? Between the age of 2 weeks and approximately 2 months, the infant raises their head and hold it in position. So, pag tinignan mo rito, ito ang number 1. Okay? Approximately at the age of 2 weeks to 2 months, the infant raises their head and hold it in position. Raise. So, 2 weeks to 2 months. Yan ang unang-una natin, ha? Okay. Tignan man natin yung pangalawa. Okay. Pagka number 2, ano kaya number 2 dito? At the age of 2 months, the baby starts to move all of their extremities, kicking the arms and legs, especially when they are prone. So, ito ay number 2. Okay? So, approximately 2 months daw yan siya. Okay. O, meron na kayong dalawang sagot, ha? Ano sa tingin nyo ang number 3 dito? Ano sa tingin ninyo ang number 3? Okay. Tingnan natin ulit ang choices. By 3 months to 6 months of age, the baby starts to roll over. So, 3 to 6 months, baby starts to roll over. The baby starts to roll over. Ano susunod? By 7 months, the baby starts to sit alone using the hands for support. Pagdating daw po ng 7 months, the baby has a tendency to sit alone using their hands for support. O, dalawa na lang. Ano sa tingin nyo ang number 5? By 12 months, the baby attempts to walk with support. By 12 months. Ito yung tinatawag natin sa Pilipinas na gabay-gabay ba? Okay? Kung sila ay nasa walker, bakitang mo yan, mag-walk sila. Okay? Which makes our last as number 6, by 15 months rather, the baby attempts to walk alone. So, ang tamang sagot po natin, dito sa number in order of progression is 3, 6, 5, 412. 365, 412. Sino ang mga nakatamang sagot? Sino ang mga nakatamang sagot? Tama ba ang mga hula natin, mga kababayan? Okay? Alright. Ngayon, minsan sa exam, hindi ka lang nila tatanungin ng developmental stages or transition. Sometimes, isasama nila yung age ng bata along with a disorder. Okay? They sometimes would ask questions, particularly in pediatric nursing, when we talk about health promotion and maintenance, they would usually include yung age ng bata along with a disorder, such as the nurse is providing home care instruction to a parent of a 10-year-old child with hemophilia. Which sport activity should the nurse suggest for this child? Should the nurse suggest for this child? Okay, bago natin sagutin ang tanong na ito, pag-usapan muna natin, ano ba si hemophilia? Pag-usapan natin, ano ba si hemophilia? Hemophilia refers to a group of bleeding disorder resulting from a deficiency of a specific coagulation protein. Identifying the specific coagulation deficiency is actually important so that yung ating definite na treatment with specific replacement, particularly agent, can be implemented. So, dalawang klase yan. Ang common type natin is factor VIII deficiency or tinatawag nating hemophilia A. At yung isa, hemophilia A is also called classic hemophilia. Yung isa naman si factor IX, si hemophilia B, or yung tinatawag nating Christmas disease. Okay. Hemophilia is a type of an X-linked recessive disorder. It's a type of an X-linked recessive disorder. Ano pong ibig sabihin nito? Kung titignan ninyo, ang nanay at ang tatay with their sex chromosomes right here, father doesn't have any hemophilia, no signs and symptoms of the disorder. However, the mom is actually carrier of the hemophilia gene. Okay? Kung titignan nyo ang distribution ng mag-asawang ito, unaffected children, 50% of their son doesn't have hemophilia. The other 50% would have the hemophilia. Kung titignan naman natin yung mga anak nilang babae, 50% of their female children doesn't have or doesn't carry the hemophilia gene. The women, the other 50% rather, is a carrier of the hemophilia gene like their mother. Tanong dito, bakit yung isang batang or yung isang anak na lalaki walang hemophilia, isa meron? Kasi itong hemophilia gene na ito, na carry ng nanay, kung yan ay maipapasa sa kanyang anak. Though normal ang kanyang Y, wala po itong capacity to neutralize the disorder. Hindi katulad kapag siya ay babae. Though this is an abnormality or this is a hemophilia gene, dahil may nag-i-exist na X na normal, kaya po niyang i-neutralize yun. So, women can actually be not affected with hemophilia. They're just mere carriers of the hemophilia genes. Okay? Okay po ba tayo dito? So, a simple representation of hemophilia looks like this. When you are assessing a child with hemophilia, you would, of course, observe presence of abnormal bleeding in response to trauma or surgery, sometimes even detected after circumcision. They will also report nose bleeding or epistaxis, joint bleeding that causes pain, tenderness, swelling, and limited range of motion. They also have a tendency to bruise easily. Okay, so to answer the question that we have a while ago, ano ba ang tamang sport activity para sa ating pasyente? Ano ba ang tamang sport activity para sa ating pasyente? Pwede ba silang mag-soccer? No. Pwede ba silang mag-basketball? No. Pwede ba silang mag-hockey? No. Kapag ang bata ay may hemophilia, bawal ang contact sports. Kasi nga, they have a tendency to bruise easily and to have bleeding. So, ang ating tamang sagot is number 3. Ang ating tamang sagot is number 3. 3 ata to. Yes, tama. Swimming. Okay? Now, Balik tayo kay hemophilia. Okay. Now, katulad ng sabi ko kanina, in hemophilia, ang ating priority or ating intervention, ang ating code dyan is yung tinatawag nating bad scene. Ano yung bad scene? B is to monitor bleeding and to implement bleeding precaution. Bad scene. Bad scene, bleeding precaution. Okay. Ano naman yung letter A? Letter A means administer factor 8. Administer factor 8. Administer factor 8. Ano naman yung letter D? D stands for DDAVP. DDAVP. Ano yun? 1-D-amino 8-D-arginine vasopressin. Alikin ko ha? 1-D-amino 8-D-arginine vasopressin. Ano po ito? This is actually a synthetic form of vasopressin that increases plasma factor 8 and may be prescribed to treat hemophilia. So apart from administration of factor 8, mag-administer din po tayo ng synthetic form ng vasopressin. Bad, bleeding precaution, administer factor 8, DDAVP, or administration of synthetic form of vasopressin. Punta naman tayo sa C. C is for check neurostatus. Check neurostatus. Children with hemophilia has tendency to form tinatawag nating intracranial hemorrhage, especially kapag nasa school na sila. Hindi natin alam, baka mamaya na-bully, na-dapa, or whatever. Check for neurostatus. And then, you also have to look into checking internal bleeding. Kasi, ang bleeding that is apparent, madali siyang ma-resolbahan, madali siyang ma-assess, madali siyang ma-treat. But if bleeding is inside, then it's something na hindi daw po natin, medyo delikado siya at kailangan natin siyang i-anticipate. And then, letter N, no contact sports. No contact sports. Click natin ha. SIN, check neurostatus, internal bleeding check, and no contact sports. Hemophilia, bad SIN. Bleeding, administer factor 8, DDAVP, check neurostatus, internal bleeding check, no contact sports. Hemophilia. Okay tayo? Okay pa po ba tayo? Okay pa tayo? Kape. Okay. Now, i-compare naman natin si hemophilia sa kanyang katandem, tinatawag natin si von Willebrand's disease. Okay? Tulad ng sabi ko sa inyo kanina, international examination, they love comparing or mga versus na ganito. So, hemophilia versus von Willebrand's disease. Ano naman po si von Willebrand's disease? Von Willebrand's disease is a hereditary bleeding disorder characterized by a deficiency or a defect in a protein called von Willebrand factor. Ulitin ko ha. Von Willebrand's disease is a hereditary bleeding disorder characterized by a deficiency or a defect in a protein named von Willebrand factor. This disorder actually causes platelets to adhere to a damaged endothelium. This disorder causes platelets to adhere to a damaged endothelium and is characterized by increased tendency to bleed from the mucous membrane. This disorder is characterized by increased tendency to bleed from mucous membrane. Ngayon, paano mo malalaman ang pagkakaiba ni hemophilia at saka ni von Willebrand's disease? Ang hemophilia, alam na natin sa lalaki siya nangyayari. Apart from epistaxis, gum bleeding, easy bruising, so on and so forth, makikita mo ang von Willebrand's disease, especially kapag ito ay nangyari sa mga babae, they have excessive menstrual bleeding. They have excessive menstrual bleeding. Okay? So, how do we intervene or how do we manage yung tinatawag nating von Willebrand's disease? Remember, TAP. Remember, TAP. Okay, anong ibig sabihin ng TAP na ito? The treatment is actually same with hemophilia. The treatment, since they're both bleeding disorder, is actually same with hemophilia. Okay? A is for medic alert bracelet. They have to have, or they always have to wear a medic alert bracelet. And letter P is to provide emotional support. Provide emotional support. Oftentimes, hindi lang po sa ating mga pasyente, most especially sa kanilang mga magulang. So, von Willebrand's disease, ang ating hemophilia, bad C. Ang ating von Willebrand's disease, TAP. Treatment is the same as hemophilia. They always have to wear medic alert bracelet and provide emotional support. TAP. Okay? Kamusta naman tayo, guys? Okay pa ba tayo? Okay pa ba? Hello? Hello? Okay pa tayo? Kaya pa? Okay. Let's go on to another type of question in the developmental stages. Katulad ng sabi ko, ini-involve nila minsan yung tinatawag na disorders along with the child's status. So an example would be the next question. A nurse is caring for a child with a patent ductus arteriosus. The nurse reviews the child's assessment data, knowing that which of the following characteristic of this disorder. Ano ba tong mga characteristic daw ng disorder na ito? Okay, now, i-refresh lang natin yung memory natin when it comes to congenital heart disease, particularly yung tinatawag nating blood circulation. Okay? If you understand the blood circulation and then the concepts that revolves around the blood circulation, it's very easy for you to identify and to understand yung mga disorders na i-discuss natin next. Okay? Sige. Drawing tayo ng tinatawag na puso. Essential na po. Ito lang po ang alam kong drawing ng puso. Okay? SBC. Okay. Okay. Okay tayo? Okay. So, ang ating simpleng blood sugar, pangit ito. Bakit ang drawing ko? Pasensya na po, guys. Wala po akong talent when it comes to drawing. Yan po ang aking, sagad na po siya. Hindi na po siya kayang i-improve pa. Okay? So, sa aking mga kaanyong dyan, heart, puso. Okay? Alright. Sige. Pag-usapan natin ang blood circulation. Ano sinasabi natin dito? Yung blood that comes from the superior and the inferior vena cava, yung unoxygenated blood, tandaan ninyo, kapag ang blood ay galing sa circulation, siya po ay deoxygenated or unoxygenated. Yeah? Babalik po siya sa puso, through the lung, and pass through the lungs para ma-reoxygenate siya. So blood from the superior and the inferior vena cava goes into the right atrium, passed by the tricuspid valve, going to the right ventricle, dadaan ng pulmonary artery, pasok ng lungs for oxygenation, lalabas ng pulmonary vein, papasok ng left atrium, dadaan ng mitral valve, pupunta ng left ventricle, and then pupunta ng aorta. Now, balikan natin ang ating kulay na tinatawag nating FEN. Okay? Sige. Ano-ano ba yung mga concept na dapat nyong tandaan when it comes to blood circulation? Okay? Our heart is divided into two sides, the right side and the left side. Okay? Ano pagkakaiba ni right side at saka ni left side? In the right side of the heart, you actually have deoxygenated blood. Bakit daw po meron ditong unoxygenated blood? Because this composed of the blood that comes from the systemic circulation. Okay? Sa left side ng heart naman, dito daw po natin makikita yung tinatawag nating oxygenated blood. that is present in the left ventricle and the aorta, magkakaroon daw po ng pag-pass ng blood from this side to that side. Ano mangyayari doon? Hindi completely nag-empty itong right ventricle na ito that would lead to overwhelming ng side na ito ng puso. Okay? Ulitin ko ha. 4 chambers of the heart. Their left side usually have increased pressure because they're responsible for pushing out the blood to or back to the systemic circulation. Pag nagkaroon ng abnormality, that leads to a connection or abnormal connection between the left ventricle and the right ventricle, magkakaroon daw po ng tendency of overwhelming dito sa area na ito. Ano pa? Third concept na meron tayo. Tinatawag po itong what goes in must come out. Anong ibig sabihin? If an amount of blood enters one chamber of the heart, this needs to be completely emptied and go through the next chamber. Yeah? Imagine kung halimbawa ang puso ay na-oxygenate, ang dugo ay na-oxygenate na at palabas na po siya sa aorta, if there are any conditions that decreases or narrows any part of the heart structure, particularly the aorta, is there a possibility na yung amount ng dugo na iyon ay may iwan sa isang side at magkakaroon ng decrease on the other side? So any type of stricture, any type of stenosis, or any type of narrowing can actually lead to a problem. Ano yung problem na iyon? Kung merong stricture, particularly dito sa aorta na ito, decrease ang oxygen supply, palabas ng system, magkakaroon naman daw po ng overwhelming amount or accumulation of blood dito sa side na ito that can actually eventually lead to hypertrophy. Okay? Ano nga ulit yung mga concept natin? Right side, left side. Right side, deoxygenated blood. Left side, oxygenated blood. Dapat hindi magkakaroon ng mixing. 4 chambers, right atrium, right ventricle, left atrium, left ventricle. Mataas ang pressure sa left ventricle, particularly si aorta, dahil siya ang responsible para mag-push ng blood palabas sa puso papunta sa systemic circulation. Pangatlong concept, kapag napuno ang isang side ng puso ng dugo, dapat ito ay completely mag-empty papunta sa kabila. Otherwise, kung merong narrowing, stricture, or stenosis, magkakaroon po ng dalawang problema. decreased oxygenation doon sa kabilang side, at magkakaroon naman daw po ng accumulation ng blood sa kabilang side, leading to hypertrophy of that particular structure. Okay tayo? Okay. Pag-usapan natin ng iba't ibang klase ng mga defects or congenital heart defects, particularly defects that increases pulmonary blood flow. Defects that increases pulmonary blood flow. Let me give you an example. Yung tinatawag nating atrial septal defect. Atrial septal defect. Pag-usapan natin ulit ha. Sabi natin kanina, ang konsepto natin dito is that the right side and the left side should never have a connection. Kung meron daw abnormal connection between the right and the left side, particularly atrial septal defect, ano nga sabi natin dito? Mataas ang pressure sa left side. Yeah? Magkakaroon daw po ba ng push, ng increase, or ng increase ng blood supply to the right side of the heart? Yes. Ngayon, itong right side of heart na to, particularly right atrium, siya magdidrain papunta sa right ventricle, papunta sa pulmonary artery. Kaya ang atrial septal defect is considered as a disorder that increases pulmonary blood flow. A disorder or a defect that increases pulmonary blood flow. Ulitin ko ulit ha. Ulitin ko ulit. Merong abnormal connection between the left and the right atrium. Left and the right atrium. Dahil mataas ang pressure ng left side, pumasok ang dugo papunta sa right side. Saan ito magdidrain? From right atrium, pababa ng right ventricle, papunta ng pulmonary artery. Mag-i-increase daw po ba ang pulmonary blood flow? Yes or no? Yes. So, anong nangyayari sa atrial septal defect? Nagkakaroon po ng, ano ba yung mga assessment findings natin dyan? Nagkakaroon ng harsh systolic murmur, particularly sa second to third intercostal space. Magkakaroon ng enlargement ng right atrium and right ventricle, of course, eventually. Infants may actually be asymptomatic, but they are prone to develop heart failure later on. They are prone to develop heart failure later on. Okay? Next disorder is yung tinatawag nating patent ductus arteriosus. Patent ductus arteriosus. Ano ang patent ductus arteriosus? This is the failure of the fetal ductus arteriosus o yung shunt na nagko-connect sa aorta at sa pulmonary artery is usually closest after the first breath of the baby. Hindi siya fully nagko-close until the 3rd months of age. Kapag siya daw po ay nag-remain open or naging remain pattern, this can actually cause problems. This increase, so ano nangyayari dito? Si ductus arteriosus, hindi daw po siya nagsara. Anong mangyayari dyan? Dahil mataas ulit ang pressure sa left side ng heart, particularly. Kapag nagkaroon daw po ng increased pressure sa aorta, pumapasok or nagkakaroon daw ng increased dugo dito sa side na ito. So ano mangyayari? Ano daw pong ating typical na assessment finding? Nagkakaroon daw po ng characteristic machinery-like murmur, particularly sa upper sternal border under the baby's clavicle. Infants may be asymptomatic, but they may develop heart failure later on. So, puntahan natin to. Sagutin natin ang ating question bago tayo mag-move forward. Okay? Ano ang ating sagot dito? Involves opening between two atria. Ito ay atrial septal defect. Opening between two ventricle. This is ventricular septal defect. Ang tamang sagot natin is number 4. Patent ductus arteriosus. Okay tayo? Pwede po ba natin ipagpatuloy ang tinatawag nating kwento? Okay. Now, punta tayo sa ventricular septal defect. Halos kapareho lang din siya ng atrial septal defect. Kaya lang na andito naman po siya. Okay? Abnormal connection is somewhere here. Same concept. Mataas ang pressure ng left side ng heart. Nag-mix ang blood papunta rito. Saan siya automatically mag-drain? Pulmonary artery papunta sa lungs, increasing pulmonary blood flow. Increasing pulmonary blood flow. Ano ang meron sa ventricular septal defect? Meron silang characteristic murmur eh. Meron silang tinatawag na loud, harsh pansystolic murmur na usually naririnig sa third and fourth intercostal space. You can also feel a thrill or a vibration along their left sternal border. Okay? Okay ba tayo sa congenital heart defect or yung mga defects that increases pulmonary blood flow? Okay pa tayo? Okay, now, let's look into the rest of the defects. Punta naman tayo sa mga tinatawag na obstructive defects. Punta tayo sa mga tinatawag na obstructive defects. Let's start with yung tinatawag po nating aortic stenosis. Aortic stenosis. Aortic stenosis is the narrowing or the stricture of the aortic valve. This actually causes resistance to blood flow from the left ventricle into the aorta. Anong nangyayari dito? Katulad ng kwento natin kanina. Anong nangyayari dito? Tulad ng kwento natin kanina. Kapag nagkaroon daw po ng stricture, ng narrowing of whatever form, nagdi-decrease ang oxygen supply, papunta daw po sa systemic circulation, nagkakaroon ng accumulation ng blood sa kabilang side. Okay? Aortic stenosis. Aortic stenosis. Okay. Apart from aortic stenosis, punta naman tayo sa susunod, yung tinatawag natin coarctation of the aorta. Ano naman yung coarctation of the aorta? This is actually a localized narrowing ng aorta near usually the insertion of the ductus arteriosus. This is a type of condition that happens most frequently in boys than in girls. Dahil mahirap dumaan yung blood through that narrowed aorta, yung kanilang BP nag-i-increase proximal to the coarctation and nag-decrease distal to it. So kaya siya tinatawag na obstructive defect, coarctation of the aorta. Alright, next is the tinatawag nating pulmonary or pulmonic stenosis. Tinatawag nating pulmonic stenosis. Ano siya? This is the narrowing at the entrance of the pulmonary artery. Anong nangyayari po dito? Dahil may resistance to blood flow na nagkukos ng right ventricular hypertrophy, ito po ay nag-lead din to decreased pulmonary blood flow. Nagkakaroon daw po ng tinatawag na hypoplastic condition ng right ventricle. Okay? So, anong nangyayari dito? Nagkakaroon daw po ng characteristic murmur kapag sobrang severe ng pulmonary stenosis, nagkakaroon ng heart failure. Okay? So, yun ang mga example ng obstructive defect. The last type of defect when it comes to congenital heart disease, yun yung tinatawag nating these defects that decrease pulmonary blood flow. Kung may mga defect na nag-i-increase ng pulmonary blood flow, may mga defects din naman daw po na nagkakaroon ng decreased pulmonary blood flow. One famous example is yung tinatawag nating tetralogy of Fallot. Tetralogy of Fallot. There are 4 major defects involved in this disorder. You have the pulmonary stenosis, right ventricular hypertrophy, overriding aorta, and the ventricular septal defect. Ano ang nangyayari dito? If the pulmonary vascular resistance is higher than the systemic resistance, the shunt that is from the right to the left, if the shunt that will happen rather happens from right to the left. Kung magkakaroon naman daw po ng systemic resistance is higher sa pulmonary resistance, nagkakaroon ng left to right. Ang mga batang may tetralogy of Fallot, they may be acutely cyanotic at birth, or they may actually have mild cyanosis that progresses over their first year of life. Ang karaniwang nangyayari sa mga batang may tetralogy of Fallot is yung tinatawag po nating TET spells. Yung TET spells. Commonly nakikita to sa mga school-age children. Pag tumatakbo, bigla na lang siyang hihinto at mag-i-squat. For some reason, itong squatting po na ito leads to a relief ng kanilang shortness of breath. Anong nangyayari? Ito yung tinatawag na, ang mga batang may tetralogy of Fallot, may tinatawag na collateral circulation. Dahil sobrang decrease ng umiikot na oxygenated blood sa kanilang katawan, the system is actually prioritizing Kung konti lang po ang dugo na meron ako, saan ko siya madalas ilalagay? Siyempre dun sa mga major organ system like the brain, the heart, and then the gastrointestinal system, leading to decrease in the amount of blood that is being supplied to the systemic circulation. Kung ako ngayon ay mag-i-squat, kung ang bata daw po na yun ay mag-i-squat, this would lead to increase in the supply of the blood, decrease siya sa lower extremities, increase siya sa upper extremities, causing temporary relief ng kanilang condition. Okay? So that's tetralogy of Fallot. Next, yung tinatawag nating tricuspid atresia. Tinatawag nating tricuspid atresia. Ano naman yung tricuspid atresia? This is the failure of the tricuspid valve to actually develop. There is no communication that exists from the right atrium to the right ventricle. Okay? So, ang ating mga obstructive defect, ulitin ko ulit, yung tinatawag po nating tetralogy of Fallot and tricuspid atresia. Okay pa ba tayo, guys? Are you guys still with me? Ay, naglalag. Sorry. Hindi ka na namin marinig. Naghang po, ma'am. Okay na ba? Hello? May mga galit na faces na naman. Naglalag daw po. Hello? Okay na ba, guys? Hello? Okay na ba? Let me know. Pasok, Ma'am Hasuki. Question did Bisaria. Guys, let me know. Hello? Hello? Yes, ma'am. Okay na po, ma'am. Okay. Pasensya na. Sira ulo lang po ako. Okay, kaya pa ba? Kaya pa? Okay. Sige. Pagpatuloy natin ang mga bagay-bagay sa buhay. Pagpatuloy natin ang mga bagay-bagay sa buhay. Ano ba ako? Ayan. Sige, ha? Okay na tayo, ha? Okay. Now, part of the isa pa sa mga common question when it comes to health promotion and maintenance, katulad ng sabi ko kanina, hindi lang siya OB, hindi lang siya pedia, meron siyang techniques of physical assessment. Famous example in the international examination is this. The nurse is percussing the anterior thorax and abdomen for tones and expects to note dullness in which anatomic location. Refer to the figure and place the numeric answer on the line below. Ano sa tingin ninyo ang ating tamang sagot? Kanina po yun yung sa discussion. Hindi nyo narinig? Sayang. Sige. May ano naman siya. May replay later. Okay na ngayon. Sige. Pamain na lang po ng sagot. Ano sa tingin nyo ang sagot dito sa techniques of physical assessment na ito? Hello? Guys? You guys still with me? Saan daw natin maririnig ang dullness sa anong anatomic location? Okay? Kasi sa mga alternative format ng questions is may mga ganito. Kailangan mo daw ituro. Kailangan mong i-identify yung kanyang location. Okay. Ano ba ang percussion? Muna. Pag sinabi natin percussion, it involves tapping. Yeah? With the fingertips to actually set the underlying structures in motion and, of course, produce a sound. Okay? Saan daw po natin naririnig yung dullness? This may be noted in the liver or the right upper quadrant of the abdomen beneath yung kanyang lower ribs sa right side. Doon daw po yung dullness. So, anong tamang sagot natin dito sa tanong na ito? Number? Bakit hindi ito? Ito dapat, guys, ito number 3 ito. Sorry naman po. Ito daw po dapat ay number 3. Dito daw po natin maririnig yung tinatawag na dullness. Pasensya na po. Nakalagay 4-4. Sagot niyo ba number 4 din? Tignan ko. Hello, ma'am. Nice to see you here. Ako'y nagtanong kagabi. Hi, Queenie. Mama, dalawa yung 4. Oo nga, dalawa nga yung 4. Pinalitan ko siya, ginawa ko siyang 3. Okay. Now, since we're already talking about sounds, ano naman ang timpani? Ang timpani, usually, maririnig mo yan sa abdomen. Pag nagkaroon ka daw po ng percussion sa may abdomen, nagkakaroon ng tympanic sound because of the presence of gas. Right? Ang resonance naman is a tone na usually maririnig mo in between the ribs. Okay? So, ano ang maibibigay ko sa inyong tip dito when it comes to techniques of physical assessment? Focus on the subject, particularly yung anatomic location kung saan mo maririnig yung dullness. I-recall mo na ang dullness on percussion is usually indicative of an organ, an underlying organ. Yeah? I-review mo yung mga techniques of percussion and expected findings kapag meron kang difficulty sa question na ito. Minsan kasi, especially kapag fundamentals yung question, so sobrang tagal na nating wala sa school, nakakalimutan na natin yung mga simpleng mga bagay na iyon. And always remember that in NCLEX, ano po siya? Depende siya sa kung paano mo sagutin. Yeah? Kung halimbawa nagkamali ka about one thing, particularly OB or kahit anong subject, halimbawa nagkamali ka sa OB, ang question ng NCLEX ay manganganak about OB. Yeah? So mas magandang i-cover natin lahat ng basis natin when it comes to international examinations. Okay po ba tayo? Okay na tayo? Okay. All right. Next question. Principles of teaching and learning. Principles of teaching and learning. Katulad ng sabi ko kanina, as nurses, tayo daw po ay parang mga teacher din ng ating mga pasyente because we have to talk to them about, of course, health screening. Tuturuan mo sila, papaliwanag mo para saan ito. If you are talking to them about healthy lifestyle choices, tinuturuan mo sila kung anong mga choices na pwede nilang gawin kung sakaling gusto nilang ma-improve ang kanilang health and wellness. Okay, Nurse Ching provides an educational session regarding the risk factors for cervical cancer to women in a local community. She determines that the further teaching is needed if a woman is attending a session, identifies which of the following factor as a risk factor for this type of cancer. So, cervical cancer to woman in local community determines that needs for further teaching. Guys, kapag sumasagot po ng kahit na anong examination, take note of key words. Take note of keywords. Pag sinabi po nating needs further teaching, tamang sagot o maling sagot po ba ang hinahanap natin? Mali. Tama po ba? Yun ang hinahanap natin dito. Ano sa tingin ninyo ang tamang sagot dito sa educational session, risk for cervical cancer? Ito tayo sa ating live. Ano ang hula nyo dito? Ay, anong sagot kanina? John Michael Seran. Number 3 po. Ito. Ito siya. Balik tayo. Sorry po. Ito po, sir. Naandito po siya. Number 3. Itong site na ito. Dullness. Okay na? John Michael? Ay, ko. Sorry guys. Ingat pa more. Pasensya na. Hello? Okay na? 2 or 4. Okay. Ano ba ang kailangan nating take note kapag ang pinag-uusapan dito is a cervical cancer. So, isa sa mga bagay na ibigay ko sa inyo as test-taking strategy, katulad na sabi ko kanina, take note of the strategic word, further teaching is needed. This type of words indicates a negative statement or a negative event and ask you to select an option that is an incorrect risk factor. Ano pa? Noting the word single. Anong tamang sagot dito? Pag sinabi kasi natin cervical cancer, ang pre-invasive cancer type is limited to the cervix. Pag sinabi natin invasive cancer, ito ay nakikita sa cervix and other pelvic structures. Pag sinabi naman natin metastasis, it's usually confined to the pelvis, but distant metastasis can actually spread through the lymphatic system. Ang mga risk factor for cervical cancer, ang mga risk factor for cervical cancers. Hello? Hello? Hello, hello, hello. Naririnig niyo ba, Mi? Hello, guys? Ma'am, yung slide. Ay, yung slide. I'm sorry. Okay. Ano mga risk factors for cervical cancer? Okay. Risk factors for cervical cancer, will that include HPV infection? Yes. Okay. Ano pa? Having multiple sexual partner, early intercourse. Actually, ang mali dito ito eh. Ito ang tamang sagot. Tama? Bakit? Take note of the word single. Kapag ka may cervical cancer, it's usually having multiple sexual partners ito. Having multiple sexual partners siya. Okay? So, ang tamang sagot po natin dito is number 2. Okay. Bigay mag-away-away, tama? Dapat love, love, love lang. Positive vibes po tayo. Kasi kung titignan ninyo ako, for myself, one of the things that I realized is that with this current situation, hindi nito tinitignan yung status mo sa buhay, hindi nito tinitignan yung amount ng pera mo sa bangko. Kung magkakaroon ka ng ganitong sakit, magkakaroon ka ng ganitong sakit. But if you keep your faith, na matatapos din tong lahat, laging iisipin, this too shall pass. At tayo ay magdasal, maghugas ng kamay, protect ourselves, stay safe, stay healthy. Hindi pa po nagkakaroon ng announcement when it comes to few examinations. So make use of the time na kayo ay nasa bahay para mag-aral. Spend time with the people who matters, and that is the people that your family. Yun lang. Sana I wish you guys all the best, and I'm looking forward to seeing you all sa mga susunod pa nating sessions. Okay? Thank you guys. Have a great day. Bye. Thank you. Have a nice day. Have a nice day too. Thank you po. Love your accent. Stick with English. Thank you, ma'am. It was very informative. It was delivered well po. Thank you po. Okay? Share po ninyo ito sa inyong mga friends para maka-watch pa rin sila. Thank you, guys. Please don't forget to like and subscribe to Top Rank Review Academy. Okay? Thank you. Bye.